Now, just before Christmas time, I witnessed this. Indeed, experts had gathered for a specially convened meeting at Stormont to try and make our cities healthier. The Children's Commissioner was there, and a number of academics. The political parties were represented also. I think the most important contribution, however, came from some school children who talked about the things that they need to make the cities healthier for our children generally. And there's so many things that they want that are acceptable and indeed should always be provided. More green spaces, safer streets, cleaner air, and having a decision in the decisions that are made when it comes to planning ahead. I want to speak to someone who's got the eye on the ball when it comes to this. Charlene Brooks, who's the CEO of Belfast Healthy Cities. Charlene, good morning.
Good morning, Frank.
The children that I heard speak that day and that you're liaising with since, they made some very good points, didn't they?
Yes, I mean, as advocates for green and blue spaces, I think, it's heard regularly our views around the importance of green spaces. So that's about children and young people as well as everyone having access to parks and gardens and different diverse green spaces. But when you actually hear it from children themselves, how much they value that and that they recognise that it's good for not only their physical health but their mental health as well, it really does make a difference.
Are you confident that the children may get what they are looking for? And there was one point made by one of the youngsters at the presentation that sort of rung a bell with me, and it was around parking outside schools and it being banned from outside schools. That is, to me, something that I think is very sensible.
Yes, I mean, for years we have been advocating for different sort of more innovative ways of managing that really difficult congestion that are at schools more often than not, and particularly primary schools. So I think it's stressful for everyone, for parents that are doing the drop-off, for schools who are trying to navigate that, for the local communities who have all of these cars and buses outside their community for periods of time. And then, as you say, the children themselves, both from a safety point of view and trying to cross streets and roads and access their schools safely, but also, really importantly, from a health perspective, the quality of the air around their schools and the impact that has on their respiratory health for children with any kind of asthma or health issues. There has huge bodies of evidence to show it is really not a good environment for them. So children themselves recognising that and asking has really given us a lever to really try and push this agenda of what can we do to make our schools a safer, more healthier environment for our children and young people.
And there are plans where your group is liaising with Queen's University's Groundswell Consortium. What's planned there, and what is the Groundswell team doing?
So part of our work in Belfast Healthy Cities is about trialling different programmes and ways of working. So it's trying to help cities look at how do we improve that urban environment. And that's what we've been doing through the likes of trialling walking buses where children can walk to school for the entire journey, or they can be dropped off at a distance and safely walk in what we call a park and stride scheme. Our connection with Queen's is really critical because what the Groundswell Consortium has been doing is working across Belfast, Edinburgh and Liverpool to look at the evidence, to look at the research. So they've been running significant pieces of work in terms of understanding the benefits of green and blue spaces, really interrogating the data and being able to prove that this will make a difference. So the link between us actually delivering the programmes and then Queen's and Groundswell, having overarching evidence really does put all the pieces of the puzzle together.
Now, you're with Healthy Cities, but there are challenges right across Northern Ireland, whether they're urban or rural, in housing, in neighbourhoods, in that active travel, or indeed in terms of the public service travel, that people find challenges and they really do feel that maybe their community or their area is being left behind. What would you say to public representatives of all of Northern Ireland if they're not aware of the relevant voices in this?
You're absolutely right. I mean, our role is particularly focused on Belfast. As a WHO designated city, we understand that there's discrete and unique challenges that are faced in an urban environment. But things like air quality, car congestion around schools, access to public transport, access to transport full stop is province-wide. We in Healthy Cities have set up a Transport Poverty Strategic Forum, and we're involved in the likes of our Department for Infrastructure, our Department of Communities, Department of Health, because this doesn't sit in one department alone. It's not only about the cost of transport, it's about having the infrastructure there in the first place. It's also about having the impact on our health. If we don't have access to schools, to employment opportunities, we were even hearing the other day that young people who've been offered apprentice opportunities can't access them because they can't either afford or access transport. So, as you say, this is really complex. It crosses all government departments, and that's what we are doing as an organisation. We're working at that strategic level to try and bring all of those partners together to see how they can tackle these approaches collectively as opposed to continuing to work in silos.
Yeah, and that's very important. That is hugely, hugely important. Let's hope you can pull them together, Charlene. Thanks very much for coming on the programme, Charlene. Thanks for your time this morning. Thank you.
Thank you. Great to talk. Bye-bye.
That's Charlene Brooks, who's the CEO of Belfast Healthy Cities, here on the U105 phone-in.